Okay, so we've got this pretty detailed chapter here someone sent us, and it's all about ears.
Hmm.
And it's from like a health assessment blueprint.
Okay.
So basically, what we're going to do is go through it and pull out, I think, some of the coolest, most interesting things, whether you're, just kind of curious about how your ears work, or maybe you want to understand, uh, when you go to the doctor, what are they looking for? What are they thinking about?
Right.
So we'll talk about, the anatomy, how it all works, some common issues that people have with their ears, and then even how healthcare professionals, go about actually assessing your ears.
Yeah, that's a great plan. I think we can definitely glean some really good nuggets from this chapter.
All right, so let's dive right in, shall we?
Let's do it.
Okay, so right off the bat, the blueprint kind of breaks the ear down into three main parts.
Yep.
We've got the outer ear, the middle ear, and the inner ear.
Exactly.
So starting with the outer ear, I mean, that's the part that we all see, right?
Right.
It's that, the pinna, or what some people call the auricle.
And then it leads into the external auditory canal. So that's basically the tunnel that goes into your head.
The tunnel, exactly. And it's, it's not just an empty tunnel. It's
Right.
lined with that wonderful stuff called cerumen.
Oh, yeah. Earwax.
Earwax, exactly. Which actually plays a really important protective role.
Interesting.
It helps to trap dust and other debris and prevents it from getting deeper into the ear.
So it's not just, gross stuff we need to clean out all the time.
Mhm.
It actually serves a purpose.
Exactly. It's got a very important job.
Okay, well, good for earwax.
And then, of course, at the end of that tunnel, we have the tympanic membrane,
Okay.
which most people know is the eardrum.
The eardrum. Okay, so let's talk about that for a second because I feel like, people kind of have an idea of what an eardrum is, but maybe not exactly, all the details.
Right.
So the blueprint actually gives a really specific description of what a healthy eardrum should look like.
Okay.
It says that it should be pearly gray, kind of semi-transparent.
And have a bit of a shine to it. And shape-wise, it's either flat or slightly concave.
Right.
So like slightly curved inwards.
Yeah, so when a doctor looks in there with an otoscope,
Mm-hmm.
That's the tool they use to look in your ears. They're looking for these very specific characteristics.
Okay, so it's not just, is it there or is it not there? They're really looking at the details of its appearance.
Exactly. The details matter.
And then it talks about these things called landmarks. What are those?
Yeah, so landmarks are kind of like, signposts or markers on the eardrum that help healthcare providers orient themselves and make sure everything looks as it should.
Okay.
So one of the key landmarks is the cone of light,
Cone of light.
which is basically just the reflection of the otoscope's light.
Okay.
And in a normal, healthy ear, this cone of light should appear at the 5 o'clock position in the right ear
Right.
and the 7 o'clock position in the left ear.
Interesting.
So if that cone of light is distorted or not in the right spot, it could be a sign that something's going on.
Like maybe there's some pressure behind the eardrum or something like that.
Exactly.
And then the other landmark that's mentioned is the handle of the malleus.
Yes.
So that's one of the tiny little bones that we have in our middle ear.
Right, the malleus, stenoprocus, and stapes. Those are the 3 tiny bones in the middle ear.
So small. I always find that fascinating.
Yeah, they're amazing. And the handle of the malleus is actually visible through the eardrum.
Wow. So you can actually see it when you look in there.
Yep. So that's another important landmark that doctors are checking for.
And then it's not just about what it looks like, right?
Right.
It's also about how the eardrum moves.
Exactly.
So the blueprint talks about this thing called mobility testing with pneumatic otoscopy.
Yes.
So what is that all about?
So pneumatic otoscopy basically involves using a little puff of air
Okay.
and gently introducing it into the ear canal.
So they puff a little air in there.
Yep. And in a normal, healthy ear, the eardrum should move slightly in response to that puff of air.
Makes sense.
But if it doesn't move, or if the movement is limited, it could be a sign that there's fluid in the middle ear space.
Ah, okay. So it's like a little test to see if there's something blocking things up in there.
Exactly.
And then on the flip side, it also talks about what to look for if you suspect an infection.
Right.
So it says that if the eardrum is red, or if it's bulging outwards, or if it appears kind of dull and lacks that shine, or if you can actually see fluid behind it,
Right.
those are all signs that something might be up.
Yeah, those are all red flags for a potential ear infection.
Okay, so that delicate little eardrum, it's kind of the gateway to the middle ear,
Exactly.
and that's where those 3 tiny bones you mentioned are hanging out.
The malleus and deicus and stapes all doing their important work.
So what exactly is their job?
So their job is to transmit sound vibrations from the eardrum to the inner ear.
Okay.
So the eardrum vibrates, and those vibrations are passed along this chain of tiny bones to the inner ear.
And the inner ear is where the magic happens, right? That's where sound gets turned into signals our brain can understand.
Right. The inner ear, it's pretty amazing. It's
Yeah.
this complex structure nestled deep within the bone,
Hmm.
and it's responsible for both hearing and balance.
But we've got the cochlea, which is for hearing.
Yep, the cochlea is like a spiral-shaped organ filled with fluid and tiny hair cells.
Okay.
And those hair cells convert the vibrations into electrical signals that get sent to the brain.
Cool.
And then for balance, we've got these semicircular canals,
Right.
which are basically these three fluid-filled loops.
I've seen pictures of those. They're pretty wild looking.
Yeah, they are. And they're positioned at different angles so they can detect movement in any direction.
Yeah. So basically, whenever we move our head, those canals and the fluid inside them tell our brain what's going on.
Exactly. And then there's also the vestibule, which plays a role in both hearing and balance.
Okay, so it's all very interconnected in there.
It really is a marvel of engineering.
Okay, so let's move on to what happens when things go wrong, because the blueprint actually has a really cool analogy for the different types of ear infections.
Oh, yeah, the tunnel and secret cave analogy.
Yeah, I like that one.
It's a good one.
So explain that,
Okay, so remember how we talked about the external auditory canal being like a tunnel?
right?
So if that tunnel gets infected, that's called otitis externa,
Okay.
and it's commonly known as swimmer's ear
Ah, swimmer's ear.
because it often affects kids and swimmers who get water trapped in their ear canal.
Right, which creates a nice little breeding ground for germs.
Exactly. And the symptoms are usually focused on the outer ear, so things like itchiness, swelling, and pain when you touch or move your ear.
Okay, so that's all happening in that outer tunnel.
Right. And then at the end of that tunnel, we have the middle ear, which is like our secret cave.
Okay, I like it.
And if that gets infected, we call that otitis media.
Otitis media.
And this one is much more common in babies and young children.
Right. I remember that always being a concern when my kids were little.
Yeah, it's super common, and it's because of the anatomy of their eustachian tubes.
Ah, yes, those little tubes that connect the middle ear to the back of the throat.
Exactly. And in young children, those tubes are shorter, wider, and more horizontal compared to adults. So it makes it easier for bacteria or viruses to travel up from the throat into the middle ear.
Especially when they have a cold or something.
Exactly.
And the symptoms of otitis media are a bit different, right?
Right. So because the middle ear is involved, which is where the eardrum is,
Right.
the symptoms can include a feeling of fullness in the ear pain and sometimes temporary difficulty hearing.
Okay, because the fluid builds up behind the eardrum and it can't vibrate properly.
Exactly.
And the blueprint also lists a bunch of risk factors for otitis media, which I thought was interesting.
Yeah, it's good to be aware of those.
So things like formula feeding instead of breastfeeding, being born prematurely,
Right.
exposure to secondhand smoke or other allergens,
Yeah, all those things can increase the risk.
pacifier use being male, and even bottle feeding in general.
It's interesting, right?
Yeah, it just shows how all these different things can kind of play a role.
Absolutely.
So let's talk about how healthcare providers actually diagnose these ear infections and other ear problems.
Sure.
So the blueprint goes into detail about the otoscopic assessment.
Right. The otoscope is that tool we talked about earlier that lets doctors look inside the ear.
So it's basically like a flashlight with a magnifying lens, right?
Pretty much. It's a very simple tool, but it's essential for examining the ear.
And the blueprint lays out a very specific procedure for using it.
Yeah. It's important to follow the steps correctly.
So first things first, you need to gather your supplies. You need the otoscope, obviously,
Right.
with a clean speculum.
That's the little cone-shaped piece that goes into the ear canal.
And you need to make sure you have good lighting.
Good lighting is crucial,
And then this is important. You need to explain what you're going to do to the patient.
especially if it's a child.
Yeah, you don't want to just stick something in their ear without warning them.
Right. It's important to put them at ease.
Okay, so then what's next?
Next is positioning the patient correctly.
Okay,
So for adults and older children, they can usually just sit still with their head tilted slightly.
right.
But with younger children, you might need to have them held securely.
Yeah, I remember those days wrestling a toddler to get a look in their ear.
It can be a challenge.
But it's important, right?
It is because you need to be able to see clearly and safely.
Okay, so once they're in position, then...
What? Then you need to straighten the ear canal.
Okay, so this is the part that I always found interesting. Because for adults and older kids, you pull the outer ear up and back.
Right.
But for infants and toddlers, you pull it down and back.
Exactly.
So why is that?
It's because the angle of the ear canal changes as we grow.
Okay.
So in infants and toddlers, the ear canal is more horizontal.
Mm-hmm.
So pulling it down and back helps to straighten it out.
And that gives the examiner a better view. Okay, so once the canal is straightened, then you can gently insert the otoscope.
Right. And you want to use your pinky finger as a brace against the patient's head.
Okay, so that if they move suddenly, you don't accidentally hurt them?
Exactly. Safety first.
And then what are you looking for?
So first you're looking at the ear canal itself
Okay.
for any redness, swelling, drainage, or excessive wax.
Right, those could be signs of otitis externa.
Exactly.
And then you look at the eardrum.
Right. You're looking for signs of otitis media, like redness, bulging, or fluid behind it.
Okay. And then you document all your findings.
Absolutely. Everything needs to be documented carefully.
Okay, so the otoscope gives you a good visual, but the blueprint emphasizes that a comprehensive ear assessment is more than just that.
Oh, yeah. It's much more involved.
It needs to be very patient-specific.
Exactly. You need to consider the individual patient's history, symptoms, and concerns.
So gathering subjective data is crucial.
Absolutely.
This is where you ask the patient a bunch of questions, right?
Right.
About any earache they're experiencing. Where is the pain located?
Exactly.
Any history of ear infections or discharge, any hearing loss, exposure to loud noises, whether they experience tinnitus or vertigo,
Right.
any past ear surgeries or other issues like ear tubes. For kids, it's also important to know if they attend daycare.
Yeah, because that can increase their exposure to germs.
And you even ask about their perception of different sound frequencies.
Right. Do they struggle more with high-pitched sounds or low-pitched sounds?
Interesting. So you're really getting a complete picture of their hearing health.
Exactly.
And then the objective data is what you observe during the physical exam.
Right. So that includes the otoscopic exam. And the blueprint has this really helpful summary checklist.
Oh, yeah, I saw that.
It covers everything from the external ear's appearance.
Like size, shape, position,
Right.
the condition of the skin,
Right.
tenderness of the auricle or tragus. Okay.
And then hearing acuity testing and the detailed otoscopic exam that we already talked about.
Wow, so it's a very thorough assessment.
It needs to be to ensure that you're not missing anything.
Okay, so let's move on to some specific ear problems that the blueprint covers.
Yeah.
Like tinnitus and vertigo.
So those are two big ones that can really affect people's quality of life.
Yeah, they can be very debilitating.
So tinnitus is basically the perception of sound when there's no actual external sound source.
Okay, so you're hearing things that aren't really there.
Exactly. It can be ringing, buzzing, whooshing, all sorts of sounds.
And it can be constant or intermittent.
Right.
Yeah.
It varies from person to person.
And the blueprint mentions that it can really interfere with concentration and sleep.
Yeah, imagine trying to sleep with constant ringing in your ears.
I can see how that would be a problem.
And there are a number of risk factors for tinnitus.
Like exposure to loud noise, older age,
Great.
ear infections,
Well.
wax buildup, and even head injuries.
So it's important to protect your ears from loud noise and to get treated for any underlying conditions that could be contributing to tinnitus.
Okay, and then vertigo, that's the spinning sensation, right?
Exactly.
Yeah.
It's this feeling that you or the world around you is spinning even when you're perfectly still.
It sounds awful.
It can be very disorienting and often comes with nausea, sweating, and headaches.
Yeah, I can see how that would be a problem.
And it's usually caused by a problem with the inner ear.
Right, the inner ear is responsible for balance.
Exactly. And the risk factors are similar to tinnitus.
So inner ear problems like infections or fluid buildup, older age head injuries, and certain medical conditions like Meniere's disease.
Right. So if you're experiencing vertigo, it's important to see a doctor to figure out the underlying cause.
Okay, so the blueprint also talks about how healthcare providers actually test our hearing imbalance.
Yep.
And there are a few key tests mentioned.
Right.
So the whispered voice test is a pretty basic one.
Yeah, it's just a quick screening to see if someone can hear soft sounds.
So they stand behind the person and whisper words or numbers.
Right. And the person covers one ear at a time to see if they can hear in both ears.
Okay, and then there are the tuning fork tests?
The Weber and Rin tests.
Yes, so those are a bit more specialized.
Yeah, they help to differentiate between conductive and sensorineural hearing loss.
Okay, so break those down for me.
Sure. So the Weber test involves placing a vibrating tuning fork on the top of the person's head,
Oh, okay.
and you ask them where they hear the sound.
Interesting.
In someone with normal hearing, the sound should be equal in both ears.
Okay.
But if they have conductive hearing loss in one ear, they might hear the sound louder in that ear.
Really?
Yeah, it's because the sound is being conducted through the bone to the inner ear.
Ah, I see.
And if they have sensorineural hearing loss, they'll hear the sound louder in the better ear.
Okay, so it helps to pinpoint where the problem is?
Exactly.
And then the Rin test.
So the Rin test compares air conduction to bone conduction.
Okay.
So you place the tuning fork on the mastoid bone behind the ear first.
Okay.
And then when they can no longer hear it, you move it quickly to just outside the ear canal. And In a normal ear, air conduction is much better than bone conduction.
So they should hear it again when you move it.
Exactly. They should hear it for about twice as long.
Okay.
But if they have conductive hearing loss, they might hear it longer through the bone.
Interesting.
And if they have sensor or neural hearing loss, they'll still hear it longer through the air.
But overall, the time will be reduced.
Right.
Okay. And then finally, there's the Romberg test.
Balance for balance.
Right.
So the person stands with their feet together, arms at their sides, and closes their eyes.
And you see if they sway.
Exactly. You're looking for any loss of balance, which could indicate an inner ear problem.
Okay, so we've covered a lot of ground here.
We have.
But the blueprint also talks about how the ear changes throughout our lifespan,
Right.
which I think is really important to consider.
It is, because different age groups have different vulnerabilities and considerations.
So starting with infants and children.
You know, it's fascinating to think that the inner ear starts developing so early in pregnancy.
Right around the 5th week.
Yeah. And then, as we talked about before, those eustachian tubes are much different in kids,
Right, they're wider, shorter, and more horizontal.
which makes them more prone to ear infections.
Unfortunately.
Yeah, it's a common childhood ailment.
And then as we move into adulthood, the blueprint mentions this condition called otosclerosis,
Mm-hmm.
which is a cause of conductive hearing loss.
And it usually starts in young adults between 20 and 40.
Oh,
It's where bone grows abnormally around the stapes bone.
one of those tiny middle ear bones.
Exactly.
And that prevents it from vibrating properly.
Right, so sound can't be transmitted efficiently.
And it leads to gradual hearing loss.
Unfortunately, yes.
And then finally, we have the aging ear.
As we get older, those cilia in the ear canal can become coarser and stiffer,
Right.
and our earwax might get drier.
Which can lead to buildup.
And then there's presbycusis,
Presbycusis.
which is basically age-related hearing loss.
Right.
And it often starts in our 50s.
And it affects high-frequency sounds first.
Ex
So things like birds chirping or the high notes in music.
Right. And it can also make it harder to locate where sounds are coming from.
And background noise can become a real problem.
Yeah, it makes it much harder to understand speech in noisy environments.
Wow. So the ear really goes through a lot throughout our lives.
It does. It's an amazing organ, but it's also susceptible to various changes and challenges.
Well, this has been a fascinating deep dive.
It has.
We've learned so much from this health assessment blueprint.
I agree.
We've journeyed through the anatomy of the ear, explored common infections, talked about tinnitus and vertigo,
Mm-hmm.
looked at how healthcare professionals assess hearing and balance,
Right.
and even touched on how the ear changes from infancy to old age.
It's been a comprehensive overview.
It really has, and it makes you appreciate just how complex and delicate the ear is.
Absolutely.
And it also makes you think about how we can protect our hearing and balance throughout our lives.
That's a key takeaway for sure.
So as we wrap up this deep dive, I'm curious to know, what are some things that people can do to kind of proactively take care of their ears?
That's a great question, and one that everyone should be thinking about.
Right, because once you lose your hearing, it's not easy to get it back.
Exactly. So prevention is key.
So what are some practical tips that people can start implementing today?
Well, first and foremost, protect your ears from loud noise.
Okay, that seems obvious, but people don't always do it.
Right. It's easy to forget or to think that it won't affect you.
So wear earplugs at concerts
Absolutely.
and when using power tools.
Yes. And even when listening to music through headphones, keep the volume at a safe level
Okay, good advice.
and then get regular hearing checkups.
How often should people do that?
It depends on your age and risk factors, but it's a good idea to start getting them in your 50s, even if you don't notice any problems.
Okay.
And then, of course, if you experience any ear pain, discharge, hearing loss, tinnitus, or vertigo, see a doctor right away.
Don't just ignore it.
Exactly. Early intervention is key.
And then there's things you can do to maintain your balance as you age.
All right, things like regular exercise,
Oh, good.
Tai Chi yoga.
And just being aware of your surroundings.
Exactly. Make sure your home is well lit and free of tripping hazards.
Good advice.
So yeah, there are lots of things we can do to take care of our ears and our balance.
Excellent. Well, thank you so much for sharing all this knowledge with us today.
It's been my pleasure.
And to our listeners, thanks for joining us for this deep dive into the fascinating world of the ear.
Hopefully you've learned something new and helpful.
And we'll see you next time for another deep dive into a different topic.
Until then, take care of those ears.
Bye.